how obesity leads to increased cancers. And this is important because many of you have lost weight, but you have family members who may be overweight or obese, and they need to be told why this is even more important than just your looks and just the knee joint pains. Majority of our patients come because they went to an orthopedic surgeon for their knee joint pain, and then they say that you get your weight down, which is a wrong way. You should be looking at weight loss in itself, and this is primarily the reason that bariatric surgery, the obesity is a problem area as far as cancers are concerned. So there are 13 cancers which are directly associated with obesity, which includes in women the cancers of uterus and ovaries, and colon and rectum, in men prostate cancers, kidney cancers, stomach cancers, and in women breast cancers. And this is a very serious issue because, let me see if I have that. Yeah. So what has happened is earlier the cancers in our country were mostly related to poor hygiene. So women will have cancers of cervix, lower genital organs. And that was because of the poor menstrual hygiene and other related issues. But now we are having cancers which are related to lifestyle. So hygiene related cancers are going down, but the lifestyle related cancers because of obesity are going up. And this is something which is preventable. If we maintain better health, we can avoid. And this was the running theme of today's meeting, that we are talking of heart diseases, we are talking of cancer and healthy cooking. So overall, lakhs of people die of cancers, but almost 15 to 20% of those cancers are obesity related cancers. So if we are able to control the society's obesity, it will lead to 20% less deaths from cancer, which will be again in lakhs of people who are dying. And this is more of a medical issue, that how these are the cells here on the left side, and all these inflammation, increased cholesterol, insulin levels, high insulin levels, and some hormones secreted from your fat cells, that makes the normal cells multiply rapidly and they become cancerous. So obesity is, again, as I am emphasizing, is more of a health issue, and that is why everybody should take care of it, not only through bariatric way. It could be diet, it could be exercise, but ultimately everybody has to bring down their weight. And the commonest cancers which happen after obesity is breast cancer in women after their menopause. And it is not necessary that only if you put on weight after menopause, then you will have breast cancer. You are already primed. So if you start putting on weight when you are in your teens as a young girl, and you are overweight till you are 40, 45 years, you are already primed to have a cancer after menopause when the hormones changes. And then in men, these are the colorectal cancers which will happen because of obesity. So it's important that at an early age, we try to bring down the weight so that we don't have these cancers which happen later. So just to give you an example, and many of you had been morbidly obese. So the uterus cancers are 7 times higher in a morbidly obese woman. 7 times higher, which is a substantial number. And the cancers of the esophagus, the food pipe, are almost 5 times more common in morbidly obese. And breast cancer keeps increasing 20% for every 5 units increase in BMI. So if your BMI should be 25, you become 30 BMI, cancer of the breast increases by 20%. And many of you had been 50, 60 BMIs. So the possibility of a breast cancer increases that many fold. And that is why it's important. Now, what happens if you undergo bariatric surgery? Because all of you have undergone bariatric surgery in past. So there are multiple studies. I know it's very difficult to determine in one program. You cannot ask me how many breast cancers I have avoided, because it's not possible. These are only possible when there are 20,000 patients followed for 20 years and then such results come. And it shows that the overall cancer rates decrease after bariatric surgery, and especially the hormone cancers, breast and uterus cancer in women and prostate cancer in men. So this is the advantage that is only related to hormone cancers. And then all, there are 33% lower risk of developing any cancer after bariatric surgery. And this is more so if it's a obesity related cancer, like 41% obesity related cancer that I mentioned, the uterus cancer, the breast cancer, and the colorectal cancers reduce after surgery. So, quickly speaking, obesity is increasing, everybody knows. Correlation between obesity and cancer is well established. It's not something that is coming out of here, it's established. And also it is established that obesity related cancers are increasing in the society. And any which way that you can reduce your weight can help you reduce the risk of cancer. So thank you so much for patient listening, because this is important. Nobody comes and talks to us that I want to reduce my cancer. They come for joint pains, they come for their snoring, they come for their appearance, many things. Everybody has a different reason. But please realize it's a very serious issue. So thank you so much.